Good morning. Myself, Dr. VIPUL GURJAR. I am the head and professor of surgery in SBKS Medical College, Vadodara, as well as private practicing surgeon in Vadodara. And today we are progressing in our laser in anorectal. In the last link, I have said about the basic of laser machine itself and laser fiber. And now today I am going to discuss about the handpiece. Uh, there are the two type of handpiece companies are providing. One is the curved handpiece and second is the straight one. If anyone is feeling that this handpiece is useless and there is nothing to know about, then I assure you, in if you are not knowing basic of this handpiece, once in your life during your surgery you will not able to perform your surgery because of this problem of a handpiece. Okay, now first, this handpiece is two. One is the straight one. This straight handpiece, it tip has a larger in caliber, so the only conical fiber and or the radial fiber can be possible inside through this handpiece. So because it's a larger caliber in size, but after bursting tip of this conical and radial fiber, this fiber becomes a bare fiber now, and you should not use this straight fiber. Otherwise, you will get a problem. Why? Okay, why? See, whenever there is a tip with the glass tip, there will be a snugly fitting of this straight fiber because of this larger diameter. Now, after this bursting of tip, this becomes a bare fiber which caliber is very small. Okay, so if you perform a surgery with this bare fiber in a larger caliber straight handpiece, what happens? There is a leg, there is a space between the tip and the fiber, so while inserting in the tissue there will be a tissue injury and that causes a more bleeding. That's why I am saying that don't use once its tip is burst. Okay, now what about the bare fiber or the curved fiber handpiece? Okay, this curved handpiece is mainly used for the bare fiber or bare fiber after this bursting of conical and radial fiber. You can use is in a curved handpiece. This curved handpiece is very useful for spraying energy in fan-like manner, or if you want to use in a lateral entry for a pile surgery. Okay, this is one point about the tip of a handpiece. Now the second point is to know about the most important part of this handpiece. If you see, if you open the handpiece, there is a inside a silicone grip is available. This silicone grip is very important to hold the fiber in situ. If this gripper is not working, then while pushing the fiber inside the tissue, the tip go back in the handpiece and there won't be any laser delivery. So this silicone hand grip is very important. Okay, first thing, this silicone hand grip is different from for a bare fiber and different for a this conical fiber. There is a difference in caliber, so you cannot interchange this grip. Okay, and how to remove the grip? It is also very difficult. See, the gripper is somewhat inside. If you cannot remove with the forceps, you cannot remove from the needle also. But if you are using a toothpick that we are getting in the restaurant, you can use this back of this toothpick, you insert and just remove. You can easily remove that grip and keep this grip as a like in a laparoscopy we are keeping the washer extra. You ask your supplier to give one or two grips in extra. Otherwise, without this grip, handpiece is useless. Now further about the curved handpiece. This is my favorite handpiece, curved handpiece. The company are giving this handpiece with the its tip with the 180 slant cutted. Okay, while our fiber bare fiber, I am asking you the bare fiber, you there is a gap between the bare fiber as well as in a this curved tip because the differentiation of the caliber. So I advocate you that there is a local tapering of this tip, so there won't be a leg area between the fiber and the handpiece tip, so it will be minimize the tissue trauma. I have made this commercially this change in the tip. I am sharing this another video about this handpiece in my next lecture. You can see there is a difference and this tapering of conical tip to adjust the fiber, and there won't be any tissue decrease the tissue trauma. Okay, now how to load a fiber. As per example, the tip of conical and radial fiber is burst. Okay, then you are using as a bare fiber. Now you are trying to insert in the curved of handpiece, so you have to open from back side loosely. Okay, then you insert this trimmed expose fiber tip inside, then you push till the tip come out from the handpiece. Okay, then you tighten. Where you tighten? Now how much you tighten? You tighten as much and just check it is not going the fiber is not going back. Okay, now how much tube is should be exposed from the handpiece? See, the length of the tip, it's depend your choice. My choice is 3 to 3 millimeter in size, but some people advocate 5 millimeter or a 7 millimeter. I am not going that much detail, but 3 millimeter there is a decrease in the trauma or the breaking of tip itself while inserting the tissue, so I am recommending this 3 mm. But most important step is what? See, this there should be a 1 millimeter exposed sheath from the tip of handpiece. Why? Okay, if you have exposed a glass fiber and you have removed the 5 millimeter outer sheath of the fiber, okay, fine, then you are inserted and this sheath is not exposed from the tip of handpiece, and you have started the energy. What happens? The energy is touching now the metal part of the handpiece and becomes hot, and because of this burn and increase the temperature, it will melt the sheath, and now the sheath is melted and it becomes a short. That means your fiber is fixed to the handpiece, so it will break itself, or now handpiece becomes a useless. So it is very important that the fiber part, the sheath part 1 millimeter should be exposed from the handpiece tip. This is one of the good understand everyone has to keep in mind. Otherwise 5 to 7,000 or something, that handpiece is gone. Okay, so that's all about the handpiece. If you have any query, please message me. Thank you very much.